Hi everyone, thank you for joining us. My name is Fanny Bauer and I'm a capacity building manager at UICC. I'm very much excited to welcome today such a great speaker as Biba Dodeva. So Biba is the founder and the CEO of Borka, and it's a great honor to have her today and to listen from her experience. So Borka is a North Macedonian organization, cancer organization, which is specialized in cancer education and access to treatment, and works across the country to counter all types of cancers. But I will let Biba tell you more about that. So Biba, behind every organization there is a story. And I'm sure that our listeners are curious to hear about your story and what were the motivation behind the creation of Borka.
Well, the health system has always been challenged in Eastern European countries, but especially in the Republic of Macedonia even more so. So there was a need for some changes and reforms in the country healthcare system. Unfortunately, at the beginning of the 2000s, my mother was diagnosed with melanoma. So I'm a singer, producer and composer in Macedonia over almost 30 years. And in that time, I didn't know anything about cancer at all. But unfortunately, two of my closest friends became cancer patients, one from lymphoma and one from with breast cancer. And after that, my mother was diagnosed, and I saw that there is a huge need. There was a demand in the area of assistance, support these people who are fighting the battle with cancer. So, somehow the citizens of our country needed an organization where they can turn for support and to have someone who is going to be the voice of all those people. So I use my celebrity status and establish Borka to fill this gap in the health sector in civil society, to cooperate with all involved stakeholders, ministers, governments, and citizens. And since July 2007, we are organized as a non-profit organization, Borka for Reaching a Day. And the mission was one of the main tasks actually was to be partner and to support health sector in all efforts for establishing a strong and functional health system, but also to supply all the requirements of the citizens and providing adequate support and psychosocial support, because I personally see there is a huge need where to find information, where to call, or who to get involved and to get some informations, because the cancer is a disease for all family, not only for the patient. So that is my short story.
Thank you, Biba. So as you said, you're from Macedonia, and I know that you're also an expert in the region, in the Balkans regions. And maybe you could tell us more about the gap in cancer care in Macedonia and Southeast Europe in general. I mean, we can imagine that the region shares pretty much similar health systems as a result of the historical legacy. But the different political and economic direction that the Balkan countries have taken in the recent year have created gap in the health systems. So maybe what are your key observations in terms of access to new treatments, in terms of therapy and universal coverage, health coverage in the Balkans?
Well, yes, I must say that, as 30 years ago, we were one federation. So all of these East European systems are somehow similar. Some of those countries are now the members of EU, but some of them are not, as Macedonia. And since 2007, we as Borka are firmly committed to actively participate in the promotion and contribution to all these reforms in healthcare system and to raise awareness, to overcome down the stigma and changing the negative perception, attitude of the disease, to empower patients to be proactive, and to inform patients that cancer is potentially curable disease. So I think that all of these countries are working on creation. We must work on creation of the new healthcare system, to identify the gaps, the problems in the health system, to lobby for implementation of screening programs, and make improvements in the quality of life of cancer patients, make improvements in access to new therapies, to on-time diagnosis services, and et cetera, et cetera. So I think that generally all the East European countries are facing this, and especially the low budget resources in the healthcare system. So that is one of the things that I think that there is a huge gap, and only by if we want to see the real changes due to all this mentioned above, I think that we need to approach systematically. So the implementation on national strategy of national cancer control plan, long-term plan, will give the best results.
Thank you. That's, I mean, we had the opportunity to collaborate together, and I've been always very impressed by your willingness to influence and shape cancer care in Macedonia and the Balkan regions. And I would be curious to know, what are your hopes for the future, and what is your message today for the World Cancer Day?
Well, you know, as a patient advocates, we have a huge, and the biggest challenge is to change something. So what we did as a Borka, you know, to close, to tackle improving this gap was, first we lobby for increasing expenditure for drugs and centralized procurement. And now in Macedonia we have 30 new moleculars, but they're not on the reimbursement on positive list, we call that reimbursement process. So we map stakeholders, we map decision makers, you know, because we think that proper mapping of stakeholders is crucial, and we approach to policymakers. They saw us as a real partner in this, not only to complain and to criticize their work, but to offer the solutions, because, you know, we must be aware that nothing happened overnight. So and even during all this battle, my closest friends died, my mom died, but we never stopped in our mission. So I think that that is one of the main reason a lot of NGOs who are fighting with cancer and who are leading the organization like this are personally involved. Majority of them are personally involved. Maybe they're patients or they are caregivers as myself. So we must improve the control and monitoring, I mean, for all EU, East European countries, and synchronize the law of the drugs issued from European agency, EMA, to follow the recommendation of all the WHO and to prove access maybe to clinical trials, and in general to create a condition for access to contemporary and adequate treatments and new therapies for all these people.
Thanks. Yeah, and we need people like you and your team. You're doing such an amazing work in the Balkan regions and Macedonia especially. What about today? What will you do to celebrate World Cancer Day today?
Well, I'm very proud that today we organize our press conference with the new Minister of Health. And I must say that sometimes in the Balkans, we are facing the very fast changing of the minister and government. So, you know, like Sisyphus, you come to the one point and then again you must work and again to reach some point. But we are fortunately with this, now this new minister was open to be part of our press conference, and we create an action to unite all the stakeholders, so the managers and directors of all the clinic that are treating cancer, so pediatric, hematology and oncology center were there on the press conference, and we unite all of them, and we agree that there is a huge need in investment in our health system regarding cancer. So we lobby and encourage the creation of new, better condition, only with the long-term plan and implementation of national cancer control strategy. So I think that now we are going to work together and we see the results in a few years.
Biba, many thanks for your positive energy and for your time. There's still a lot to do to close the cancer gap in the region and especially in Macedonia. But you and your team are clearly making a huge difference, and we are very proud to collaborate with you and to support you as a very committed organization. Well, I would like to thank you again and thank you all of our listeners, and wish you all a happy World Cancer Day. Thank you.
Thank you. You know, the health has no price, it's an investment, but no matter how big or small we are, in which country we are, we must take an action to close this gap and to save lives.